Hello everyone, how's everyone doing today? I hope that you guys are fine, you guys are doing good. So, I have thought about it for a long time. Not a long time, because I was thinking about it till I got my lumbar spinal fusion done on the L5S1 section. That I'm gonna be making a video once I'm done with the surgery, once I'm recovering from the surgery, how it is to recover. So this video is all about my personal experience with the spinal fusion, lumbar spinal fusion surgery that I had at the L5S1 level, single level spinal fusion surgery, and that I had like around 3 months ago. I completed my 3 months post-op on the 19th of this month, 19th of November, and I'm gonna be talking through all the all the things that I had experienced before the surgery, how it started, and how did I made it into a worst monster of my back, and how can you guys prevent it, and how do you feel going towards the surgery and then coming out of it. And I'm going to be talking about how's the recovery of from the spinal fusion that a person goes through. I mean, everybody is individual, individual vary. Different people have different time frames and different a different way that their body can recover from a spinal fusion. But I'm going to be letting you know that how I am coping up with it, how I am facing my recovery with the surgery, and how I have recovered till the time post surgery, and then at the time of surgery, and sorry, pre surgery, at the time of surgery, and then post surgery. So, yeah, well, my name is Wes, and I'm here to tell you about my personal experience with the lumbar spinal fusion back surgery that I had like 3 months ago. So initially, I'm gonna start with what had happened. What had happened? Okay, I used to be a very fit and active guy. I used to lead a very active lifestyle. I used to go gym every day. I used to do cardio every day. I used to eat properly. I never smoked. I never drank. I never did any drugs. So I was leading a very healthy lifestyle. So what had happened was that I was a fan of Ronnie Coleman. So I have seen him. I've seen him lift heavy ass weights. Those, and then he used to chant lightweight baby. So he was kind of my idol. I mean, he still is my idol. So what happened was that I saw him doing the deadlifts and then the squats and all the heavy lifting that a guy is supposed to do at the gym while he's bodybuilding, specifically bodybuilding, not any other kind of physical activity. So what happened was that I still if I can go like around 5 6 years back, I was doing my T-bar rows apparently. So when I was doing my T-bar rows, I had gotten my workout warm up in. I was feeling good. That was like a normal gym, normal day at gym for me, nothing new. So I guess on the third set of my T-bar row, I kind of hear a clack on my back. But I was young. So I was like, maybe it is just one of those days that I just heard my bone popping. So I was like, let it be. Let's move on with the exercise. So I completed my workout, and when I came home, I had a weird pain, but the pain wasn't that bad. But I did not pay any heed to it, because you know how we are in when we are young. We don't really pay much heed to what our body is trying to tell us. So I just kept on with my life. I was a very heavy guy back in the day. I was around 200 pounds of. I was carrying around 200 pounds of weight. That equates to around 100 kgs. Of almost 95 kgs of weight on my body. So I was young. I didn't pay much heed. I was in my 20s. I was young. So I kept on working out with that slight pain that I had in my back, and I didn't go to a surgeon. So life moved on, and that pain kind of it was like a ticking time bomb. It was like a slow poison which was making its ways in my body. So the pain got increased with time, but I didn't pay much heed to it. As usual, I was going on with the life. 5 6 years went by, and then I started to have like severe pain on my back. I not really severe pain. That was a manageable pain. So I went to my surgeon. I went to a neurologist in back in Pakistan. So he's like, you have popped your disc at the L5S1 levels, and you need to do the physiotherapy for that. But I was living a very shenanigan filled lifestyle. I didn't pay much heed to it. I didn't do the physiotherapy. I did it. I believe that I did the surgery for like a week or so, and then I left it. So I was hitting the gym regularly, heavy weights and everything. So some time more passed by. I mean, and I guess in the year, I guess 2 years back, back I kind of started having a little severe pain that it was difficult for me to move onto the certain sides of my body. So what happened was that I went to got my MRI done, and I saw that I had a degenerative disc disease at the L5S1 level of my spinal cord, lumbar spine. So I was like, okay, what is it? So the surgeon was like, it might sound very dangerous that the degenerative disc disease, it is some kind of a disease, but it is actually not. It is like a normal aging process that your spinal cord goes through. I kind of fast paced the process a little bit because I was doing bodybuilding, and I was, not taking care of my spine and the body like I should have. So yeah, this is what had happened, and the doctor told me to stay away from certain exercises which might pain me, and take care of my back. But I did not listen to him, and I kept on bodybuilding. So what happened was that around 6 months ago, I was leading my normal life. I was working out with the pain, and I did not feel anything bad in my back happening. That was just a normal pain that I used to live my life through every day. So I was pushing my bike on the ramp in Pakistan, and what happened was that I kind of blacked out in my eyes. I did have my senses. I did not fall down. I did not faint. I did not pass out, but I kind of blacked out with the pain. I was like, oh man, something has happened in my back. So I was like, maybe the same has kind of the same pain that I used to have has kind of gotten back, and it used to come back, in pockets for a certain period and intervals of time. So but the good part about it is that the pain used to come, and it used to go like after 3 or 4 days. I used to take my normal medication of ibuprofen, and certain Tylenols and paracetamols and Panadols that we have in Pakistan, and it used to go away in 3 4 days. But this time around, the pain was here to stay. So I waited for a week, but it did not get better. So I was like, what am I supposed to do with it? Because the thing is that I had my immigration of USA, and I had to take a flight in like 1.5 months of time. So I was a little wary about the fact that, because once I arrive in USA, I won't be having any insurance right there and then to start my recovery from there, or maybe start from the point where I have left in Pakistan. So I was a little cautious about it. I was a little worried about it. So I was like, what to do about it. So I got my MRI done of the lumbar spinal the area, the vertebrae area. So I took the MRI. It was very bad at the L5S1 level. It was bad on the above levels as well, but the L5S1 was the worst. But because the disc had almost vanished. So I took it to the first neurosurgeon in Karachi, and the surgeon told me that don't do anything with your spinal cord, don't do any physiotherapy, don't do any epidural injections, just go for the surgery, because you require a surgery right now. So I was a little apprehensive about the surgery. I was a little reluctant. I was thinking about maybe if I could somehow manage this pain for 3 to 4 months when I go to America, and then once I get my insurance going, then I'm gonna have my surgery over here rather than over there in Pakistan, because God forbid if something bad happens, and God forbid, I have heard the horror stories related to the lumbar spinal fusion and back surgeries. So I was like, let's wait, let's give it some time, and I'm gonna get my surgery done once I go to US. But the problem was that the pain kept on growing. It was never subsiding, to the extent that I couldn't properly sleep. And it was difficult for me to get up from bed, and it was difficult for me to obviously bend down. I wasn't bending down without placing my palm on my knees. I couldn't lift any heavy object without navigating my body through a certain routes, which would not which wouldn't be painful for my back. So what had happened was that my neurosurgeon told me not to go to physiotherapist, not to get epidural done, just get the surgery done, so that I can recover from it. So I what I am I being a guy, I being a Google scholar, you know, I thought of going to the physiotherapist. I went to an hospital in Karachi. It was called Liaquat National Hospital. So I went to a physiotherapist over there, and he looked at my reports, and he did a little physiotherapy on me. He put me through the tense machine that the physiotherapists usually use. So what happened was that I really felt good while I was, getting that procedure done, the tense procedure done. And then he kind of, uh, did a small, gave me a little physiotherapy a little bit, so that I can get well with my mobility, which felt a little painful at that time. But I was like, maybe it is a part of physiotherapy, and then the pain will subside. So I came back home, but the pain kept growing to a point that I could not sleep. I was screaming while I was at the night time. I was restless. I was crying. So I was to that extent. So it went to that extent. So what happened was that then I mean, the other day I called my friends. I was barely able to walk, though they came to pick me up from my house. They took me to Aachen Hospital, and over there I only went to get the epidural steroid injections done in my back, because I have heard that those injections are good to you somehow subdue your pain for like 3-4 months, so that I would come to America and get my procedure done over there rather than Pakistan. So I went to the pain management clinic at Aachen Hospital. I showed my MRI to the doctor, and when he saw my MRI, he was like, your case is out of our hands. We cannot, give you epidurals, and you're better off going to a surgeon, and he would be the best person to tell you that what is your next step in your health journey. So I was like, okay, I could barely walk. I was so bad that I was on my wheelchair. So my friends literally, excuse me, had to push me through to the surgeon's office. So I went to the surgeon office. The surgeon was Dr. Akbar Jalil. So what happened was that I went to him. I showed him my MRI. I told him, I have my flight to take after like 1 month's time to America, and that's like a 19-hour flight from Pakistan. So recommend me. What do I do? So the doctor left it on me. He's like, if you can manage your pain with opioid medications, then it would be really good. It's up to you. It's your call. He's like, your back is bad. I can get it operated, but if you can manage your pain and you want to get your surgery done over there in America, it's your call then. But the pain was so I took like 24 hours of time to think from the doctor. I was already taking opioids back then, which my pain doctor had prescribed. So my pain kind of got better, a little better. It was manageable. I was limping. At least I'm not in the wheelchair. I was limping on my way back to home. After taking the opioids, I did feel that my left leg, it went numb for I guess around 50 to 60%. So I was like, maybe it is the effect of those medications that they have numbed my leg. But anyways, I got home, I consulted with my mother, and I thought about getting a surgery done here in America or rather than Pakistan. So I was like, since Aachen Hospital is like the biggest hospital of Pakistan, the most trustworthy one. So I was like, let's take a leap of faith and let's go and get my surgery done. And I hope that I can recover in 30 days of time, so that I can take a long flight, 15, 16 hour, 21-hour flight from Pakistan to America. So I called my doctor. He was a spine surgeon actually. He was a neuro, not he wasn't a neurosurgeon. He was an ortho spine surgeon. So I told him that I want to go ahead with the surgery. So he like, okay. He gave me the time after 3 days. I I went to the hospital. I got admitted the first day. They put me on the pain medications. I felt really good, but the left leg, my left leg was numb, 50% numb. But I wasn't feeling any pain because of the opioid medication. So what happened was that the day came, the D day came, the surgery day came. So they took me in the surgery room, and what happened was that they I mean the doctor told me that you're gonna go to sleep in like in like a couple of seconds. I was like, okay, so I was ready for it. So doctor told me that it will be a single level fusion at the level of L5S1. It will be a lumbar fusion. He asked me beforehand that what kind of screws and nut bolts that I would want to get fixed in my body, because you have Chinese available as well, and then you have the Medtronic original available as well. So I went for the Medtronic ones. Obviously, they were a little on the expensive side, but when you're going for your health and your body, you cannot compromise. You should not compromise on your health. So I went for the most expensive ones. So that the surgery day came, they took me to the operation theater. They gave me the anesthesia. I went to sleep in just like maybe 4 seconds, barely 5 seconds, and they operated for me on me for 3.5 hours, and then I got up after around 3.5 hours, and I saw my friends and my mother standing right next to me, and yeah, I got up. I was very dizzy. They took me to the the recovery room, and after the recovery room I was sent back to the ward, where in the hospital I stayed for like 2 more days, and then I got discharged. So I mean the surgery went very well, but one thing that I would want to say that after I got my surgery done, after got into full senses, I couldn't feel my left leg. Like 80% of the leg was numb, and it was like this. My foot was like this. So I had developed foot drop syndrome, if I am not recalling it mistakenly, if I'm not saying it mistakenly. So yeah, my foot was dropping. My left leg was 80% numb, and I was a little worried. I was like, oh god, maybe while the operation was going on, they damaged my nerve, and I'm done with this leg for the rest of my life. So the doctor came. He's like, it's going to take a little while to get the nerve and your leg to heal. So I was like, okay. So I was like, I mean, even God forbid if it doesn't recover, at least I'm pain free now. I can move on with the life. And because I'm Muslim, Alhamdulillah, and we always say that no matter what the circumstances are, we should always thank Allah that even if he takes our one hand, we still have the other one. Even if he takes his one leg, we still have the other one. Even if he takes our entire body, we still have like a brain functioning. So this is what we Muslims believe on. We should always be grateful to Allah that whatever comes to us, we take it as a test from Allah. So I was like, okay, that's a test from Allah, and I have lived good years of my life on both the legs. Now maybe it's time to live my rest of the life on 1.25 legs. So yeah. So I got discharged from the hospital. The doctor told me I should be walking as much as I can. They stood me up on the next day of my surgery. I started walking with the walker inside the ward. I was limping bad, obviously, but then the second day I was limping my way back home without any support, very very slow. It wasn't painful, but I could feel that some procedure has happened in my lower back. So this is what happened. I came home. I was on opioid medications for 2 weeks. I had my stitches, and I kept walking every day in the house. I did not go out because I have the stairs to come down from. So after 2 weeks, I felt very good after the surgery. I did not have any pain, nothing as such. It is just the numbness, and it is just the maybe a little what do you call it, a little pain in the incision side. So that was it. So what happened was that I went I mean after 2 weeks I got my stitches removed, and the doctor told me to start with my physiotherapy. So what happened was that after 2 weeks I started my physiotherapy at home, but I kind of felt a little bad on my back. So I stopped it. I was like, maybe I shouldn't do it. Let me wait for a little while. I was taking the vitamin D and calcium supplements. I was on medications for 2 weeks, and after 2 weeks, all the medications were taken away, and that was it. But my leg was still the same way. It was around 80% numb. So as the doctor had ordered, and as I had studied online, I started walking a lot. I used to go to walk for like 10 minutes or so, 12 minutes or so, no matter how much time it would take. And yes, there is one thing that I would mention over here, that, I was a very fit guy. I was very active. I had a good cardio. I had a good muscle. So I was thinking that I will be recovering from it in a good way, but this surgery did hit me, because the recovery in while you are recovering from the lumbar spinal fusion back surgery, your body loses around 50, 60, 70% of its strength and its endurance, and you get fatigued just like that. You walk for 5 minutes and you'd be like, ah, I have ran a marathon, and you need to just lie down on your sofa and recover from that. Because I mean, I have heard that since your bones are healing, your body extracts all the strength and endurance from your body, and use it over there somehow to make your bones fuse and make you recover faster. So that's why you don't have any energy and endurance left in your body. So this is what had happened. I kept walking. I kept building my stamina. I ate clean. I did not eat junk foods. I did not eat I mean. I did not change my diet. From what I was supposed was having before the workout in my before the surgery. In my workout days, I was eating the same. So yeah, because see, the thing is that after your surgery, you are more prone to gain weight. So you need to make sure that you do not eat junk, because you're lying down, you're not doing any cardio, you're not walking much. You're gonna gain weight just like that. So make sure that you eat clean afterwards. And if you guys want any what do you call it, any diet plans, I would be happy to give them to you, or sell them to you at a very nominal fees. So that would really help you guys to prepare ahead of the surgery and afterwards of the surgery. So I kept walking, and now my pain, I mean, yeah, okay, so in the middle there was times that I developed electric legs or electric feet, or burning feet. So my left foot would burn like anything, it would get electric shocks in it, where I would try to sleep, and I couldn't sleep at night because I was getting big shocks, electric shocks. And it was the irritation was there, so I wasn't really able to sleep. So people told me that when the nerve starts to wake up, when your nerve starts to get recovery, this is why you feel something like this in your pain. So you have to somehow bear and tolerate, and just go through that difficult phase of time. So I started taking gabapentin. It helped me a little bit. I only took like 300 milligrams of gabapentin at the night time when I was sleeping. It helped me a little bit. And the good thing is that the electric feet, they stopped happening after like 15 days. I don't know if it was because of gabapentin, or maybe I was walking and I had a active lifestyle. But I'm glad that it happened, because I wasn't able to sleep because of those electric feet. I would just get up like 5 minutes after 5 minutes in the sleep, and no matter what I do, the irritation and the electricity in my feet just won't come. It will be like electric shocks. They're gonna come in your feet, and you'll be like, oh man, what do I do? Because you cannot do anything about it. So the time went, and now I am post 3 months, 90 days of my spinal fusion. I feel really good. My left leg and my feet has recovered around 80%. Only 20% of the numbness remains. So I'm very happy about it. I'm walking around 45 minutes to 1 hour every day. I have come to America. I survived a 21-hour flight. It was difficult, but what I did was that initially I had my flight after 30 days after my surgery, but then I pushed it back to 30 days more. So I had like 2 months to recover till I take my long flight, the 21-hour flight. So I came to America. Even in the flight, I kept walking like every hour. I kept stretching, and this is how I managed the flight. And now I'm recovering pretty well. Yeah. But the thing is that there are a few things. I'm not lifting anything. I'm not bending too much. Just a little bit. I'm not bending and lifting anything at all. No, I'm not. I'm not taking this risk till my surgeon tells me that your spinal cord has finally fused together. And only once my surgeon says, then I'm gonna start twisting and bending forward, or maybe doing a strenuous activity. So yeah, that was my. I mean, and I'm gonna start my physiotherapy from today, like a proper physiotherapy, and I hope that it will help me heal as well. And as they say that you expect the recovery from a spinal fusion From some people recover it in 6 months, complete recovery. Some people take 12 months. Some people take 2 years. And also they also say that if your nerves do not recover till 12 months, then they are permanently damaged. So yeah, let's see. I hope that the 20% of the nerve damage that is remaining in my leg recovered soon, so that I can completely get back to my life. So yeah, that is the thing. That is what I wanted to share with you guys. I do expect to recover from my spinal surgery in a couple of days. I feel really good. I walk every day. I eat clean. I stay happy. Don't get depressed. So yeah, that was my story of the lumbar spinal fusion. And if anybody has any questions regarding the operation, or its alternatives, for instance, I asked in Pakistan that if they're going to do the disc replacement surgery rather than the spinal fusion, because the risk of spinal fusion is that you might develop ADD in the future. ADD is adjacent disc degenerative disease. Because when you've got two vertebrae fused together, it puts more stress on the lower and upper joints. So the probability of having degeneration in your upper and lower disc gets more. So that is why I wanted to go for the disc replacement surgery. But the sad part is that Pakistan is a little backward country, and in Pakistan we did not have it available. So we only had spinal fusion. So I was left with no other choice. Probably if I had a choice, I would have gone for the disc replacement rather than the spinal fusion, because I believe that it is better. But then again, I'm not a doctor. I may be wrong. Your surgeon can tell you better. So yeah, if you guys so the surgery, I mean, so the recovery is going very well. I feel very good now. I'm recovering. I'm walking every day, and I just want to tell you guys that um, the back surgeries, they have different outcomes on the different people. There are variable factors that you must consider before going to a back surgery: your age, your weight, your physical fitness, your your recovery time, everything, and your job. So yeah, and the good thing about me is that I had already left my job when I had my surgery. So I've been at home since 3 months, and I have recovered I mean, all the 3 months I did not have anything to worry about, because I was coming to America anyway, so I had already left my job. So yeah, in those 3 months I did not work at all. So now I feel that I can go and start working again. Obviously not into bending and lifting stuff, but still I can sit for long periods of time and do strenuous work. And yeah, immediately once you come back from the surgery, you wouldn't be able to sit for long, because it will pain you, and you will get tired, and you would just wanna lie down after every 10 minutes of sitting immediately after surgery. But it will get better with time. It will get better with time. You need to keep your diet good. You need to keep your weight in check. You just need to have a positive mindset towards the recovery. I know that you can always dive into depression, because the recovery is slow. But then again, if we are living, we have to hustle, we have to grind. We cannot just lose hope. And in my religion, losing hope is considered a same sin. So yeah, this is what I want to say. I wish anybody that is going through the same pain, sciatica, degenerative disc disease, or any kind of surgery that you guys are going to have, to talk to your friends, not really friends, actually talk to your doctors, and then make up your mind for it, because the recovery will be wrong, and recovery will be different from every other person, for every other individual. Me, I was a very fit guy, and it is difficult for me as well. So I wonder that people who are a little bit old and are not really fit, how would this surgery, how would they cope with the surgery after fusion is done? Because I have read horror stories as well, that people, the surgeries have gone bad and they're still in pain even after 2 years. So yeah, talk to your surgeon, and evaluate your circumstances, and then make up your decision. And if you guys have any questions regarding sciatica pain, degenerative disc disease, spinal fusion, or recovery, or diet, or anything, just let me know. Just shoot me a comment over here, and I will be happy to answer you and help you guys. So thank you so very much. I hope that this video of mine was useful for you guys, and it was valuable for you guys. And if you have any questions, just shoot me a comment in the section below. I will be happy to answer. And yeah, that's pretty much it. That's pretty much it. I just hope you guys have a great life, have a great healthy life. And that is it. That is it. Take care then. Take care. And yeah, don't forget to subscribe to my channel and hit the bell icon so that you get my videos. I mean, I always I make the content for Pakistan in Urdu language, but I would also be making the English language content for the people all across the world. So yeah, thank you so very much. Take care. Bye bye.